tardes a todos. Mi nombre es el doctor Vladimir Alba. Soy tesorero de la sociedad, en este caso de Amexipied. El día de hoy tenemos el gusto de presentar Amexipied de la industria. Va a ser una sesión en conjunto con grandes expertos, además de la casa de la industria, en este caso de Medsten, la que afortunadamente con la participación de estos dos grandes expertos que vamos a tener, vamos a dar un tema que en este caso va a ser el uso en el pie diabético de las ondas de choque. El día de hoy tenemos dos grandes expertos. El primero es la enfermera Susan Baines. Ella es experta en el tratamiento avanzado de heridas. A su vez también es experta en el tratamiento de las ondas de choque. También tenemos como nuestros ponentes el doctor Perry Meyer. Él es director del Instituto de Meyer. Ellos están en Canadá. Vamos a hablar un poquito más acerca de esto. Tenemos dos grandes ponencias. En este caso vamos a empezar con Susan Baines. Realmente les agradecemos mucho en la espera. Vamos a intentar que el día de hoy, más que otros días, nos den la experiencia, grandes profesores, grandes ponentes de este tema con respecto a esto que es lo que nos importa tanto, que es el pie diabético. Muchas gracias. It's really a pleasure present to the expert Susan Baines, expert in advanced good care and shockwave therapy. Susan, nice to meet you. Thank you.
Pleasure.
The microphone is yours.
Thank you so much. Thank you so much. It's a pleasure to meet you and to have this experience, and I hope it's the beginning of a long relationship. So I'd like to...
Un momento. Por favor,
okay.
Hay el sitio de interpretación, todos aquellos que necesiten para translate la plática. En la parte de abajo, ahí pueden poner lo que es interpretación, ya sea en el idioma inglés, en el idioma español, el que ustedes gusten. Thank you. Coming, please.
Okay. So I'm here to talk to you today about a fairly new technology that we are implementing into the wound care world. PACE technology, I'm going to move this, is pulse acoustic cellular expression. I'm sorry. And what that means is that it is a high energy acoustic pressure wave in the form of in the shockwave spectrum that is created through electrohydraulic energy. And I'm going to be going quite quickly. Carlos, did you want to translate that before I go on?
Yes, Susan.
I'll put it back on so you could see what it says. This is the concept of the energy. We're not hearing you, Carlos?
No, but the public listen to the translator to the Carlos.
I see, okay. Okay, there are many types of shockwave technologies, and PACE is based on electrohydraulic shockwave. The reason for that is we create a larger focal volume and a treatment area. We also get a deeper penetration. So the significance of the technology is that it is a quick rise peak on the positive plane, and a tinsel phase. The positive rise is the compressive phase, and then we get the tensile phase on the negative plane, and this is where cavitation occurs. Just bear with me and you'll understand in a moment what that does. So the shock wave actually causes a stress on cells, stretching them and contracting them. And this causes a biological response because these microjets align against the cells. When they explode, they nudge the cells to move them, especially if they are in a chronic phase. They will nudge and move the cells, and the biological response that we see are things like we have oxygenated blood or perfusion, which comes to the area almost immediately. And with this, we will see arteriogenesis, widening of the blood vessels. And this enables the other nutrients and properties that is required for healing to come to the area. So essentially, we are moving from the chronic phase back to the acute phase to enable the process of healing. So the energy stimulates the body's natural wound healing process in a non-invasive way. It is quite painless, and it is administered in a relatively short period of time. It doesn't require any specific conditions in a typical wound care office or clinic, and it works with the standard of care. The results, the biological results that we see is immediately an increase in blood circulation, a stimulation of blood vessel growth. So before I showed you how deep the penetration of the energy is, and that can reach the microvascular level. The indication for use is for diabetic foot ulcers, venous leg ulcers, arterial ulcers, ischemic ulcers, pressure ulcers, essentially any type of injury, trauma, skin condition. This is what it looks like as it's being applied. Our evidence is based on our de novo study that was submitted to the FDA in the United States. It is a phase 3 random controlled double-blind study. The number of subjects was 336 patients, and the results were quite impressive. So we typically saw wound area reduction within 6 to 8 weeks. And at the beginning of the treatments are once a week. And at the beginning, in that 4-week period, we saw a wound area reduction of 50%. And I'm going quickly over this because I would now like to turn the floor over to my colleague, Dr. Perry Meyer at the Meyer Institute in Hamilton, which is very near Toronto in Canada. And Dr. Meyer operates one of the largest private wound care clinics in our country. In our healthcare system, as you know, is a socialized system, and it is administered and operated by the government. And we have very few private clinics, but Dr. Meyer has one of the biggest and, in my opinion, one of the best in our country. So Dr. Meyer, I'd like to invite you to introduce yourself and give us a an overview of your clinic. Start off by telling us how many patients you treat.
Sure. So my name it's Perry Meyer. I'm a wound physician here in Hamilton, Ontario, in Canada. I have a large diabetic wound center here that is an ambulatory one, not associated with the hospital, but we see quite a number of patient visits a year, between sort of 15 and 18,000 patient visits a year. We do about 85% of that is wound care. The other 15% is preventative care, which is critical in sort of maintaining the work that we do and trying to keep our patients' feet ulcer-free. And it offers us an opportunity to educate the patient about their feet and about prevention, but also about diabetes. Obviously, that's important. We have a process by which we get all of our information. It's gathered by three. We have my staff includes 3 nurses who are very skilled in wound care and debridement. They probably are the most skilled certainly in Canada amongst the nurses, and they manage this volume of patients fairly well, seemingly effortlessly, but there's a lot of effort that goes into it. I have an executive assistant who runs my administrative side. When the patients are seen here, we have a process, and it involves data gathering, history, physical examination of the lower limbs, examination of their blood vessels through vascular testing. We use a pulse volume recording device, which eliminates any problems with hardened arteries in our diabetics. We check their nerve function with a biothesiometer. That's a vibration perception threshold. We also will photograph and measure all of our patients' wounds and track them using a wound app called Swift Medical. The prevention and management of wounds and of diabetes in general is an ongoing process, and it really does involve repetitive information given to our patients over and over again in order for them to understand a bit better about their diabetes, but also understand how diabetes affects their feet and what's the interplay, how are the complications that arise from diabetes causing these wounds, and how do we then reverse that by teaching our patients some things, but also implementing preventative measures like footwear and foot checks and a regular visit to either us or a local podiatrist for the preventative care to deal with their nails, calluses, and inspection. So that's kind of an overview of what we have here. To know what we do a fair range of things for our diabetic patients, our diabetic wound patients. We are a large debriding center. Obviously, we need to surgically debride these wounds, and we are skilled in debriding any of these wounds. Our spectrum of care is broad, and the kind of surgical procedures is also quite varied. We obviously do surgical debridement of high-grade wounds, as well as amputations of digits, of toes, doing ray amputations, forefoot amputations. We stop at the forefoot. Major amputations are done in the hospital, but we do all of these operations, including thousands of flexor tendon releases, et cetera, here in the office in an ambulatory setting. It works out well for us, and we have a process by which I think we've kind of taken care of the difficulties that might arise under those circumstances, but it works well for us and our outcomes are quite good. I think that perhaps maybe we could show a video of us using dermaPACE in here, and I'll just give you just a little bit of an overview of what we were doing. I just finished a 4-foot amputation on a patient, and we then used and continue to use dermaPACE for a variety of things. We'll talk about that later, but in this instance, we are using it to improve the annealing or the stickiness of the wound edges and to reduce the amount of edema that comes directly after surgery like this. This device works very well for that, but the healing properties of it are quite remarkable, and we can talk about that a little later. But let's look at this video. Oops, daisy. Okay, sorry. Let me bring this up. And this is, let me just play the video, and then we can talk about it a bit later.
This is a video of a couple of cases that we did recently using Sanuwave's dermaPACE to treat the tissue after our primary closure operations. In this case, a 4-foot amputation, and the second one was a 5th ray amputation. We're using dermaPACE to stimulate the microvascular circulation in the tissue surrounding the incision lines, as well as speed up the annealing process of the incision line itself. In addition to the perfusion aspect of the dermaPACE, we are also interested in seeing how it reduces or affects the postoperative swelling. And this is the tissue after a session of 1,000 pulse waves. The tissue is nice and pink and looking very well perfused.
So that's a good example of, it gives you an idea of how easy this is to use and how it looks when we're applying it to a foot. But it is a device that when you need to use it, the application or a treatment of 1,000 shocks, it will, from setup to takedown, we can do it in about 7 minutes. And that just for your own sort of idea of how this might fit into your wound clinic and how much time it would take, you can sort of count on being able to start and finish completely within 15 minutes is completely doable. And Susan, you want to talk about these slides?
I'm just, as you're speaking, I'm just showing before and after pictures of typical ulcers that you would see in a clinic. And as I hope you can see the time lapse, some of these ulcers are, of course, in the acute phase. For instance, this one with this necrosis on it began treatment in August 10th of 2018, and then of course went through a debridement, and then as you see the end results here, September 4th, 2019, a considerable amount of wound area reduction. Just go back.
Susan,
yes.
So I think it's important on that particular, just to describe a little bit about the effects of dermaPACE and how it might explain some of what we're seeing on the screen.
Of course.
The first slide that you showed where the heel was quite necrotic. This was a pressure sore. We see these frequently. I'm sure that our audience knows of these after long hospital stays often can arise, patients lying in bed for prolonged periods. These are very difficult wounds to turn around, and particularly when there is some impairment in the blood flow. But with dermaPACE, as you can see, with the debridement of the eschar, the necrotic piece, and then the application of dermaPACE, you've been able to turn around the tissue from a very inactive, underperfused, large piece of tissue. So this was at that point on the left there, the wound size is around 20 over square centimeters. That's a huge wound, and in an area that is extremely difficult to heal. And with the application of a dermaPACE over a prolonged period of time, albeit not forever, and for these kinds of wounds where the alternative is leg amputation. So this is, the patient has a vested interest in healing this wound because, as you can see on the right, that wound is well on its way to healing, and it's come off of the plantar surface of the foot. So this patient will be able to walk with this at this point. Whereas before, if they walked on the wound, as we all know, pressure on these wounds, these diabetic wounds, is the worst that can occur to it and will worsen it tremendously. So to be able to turn a wound like this around in relatively short order, it's not overnight, but in these kinds of wounds, when not treated this way, go on for very long periods of time and very, very frequently end up with leg amputation. So yeah.
Well, I just wanted to explain the actual procedure. So I'll go back to a picture here. Here we go. The treatment is administered, or shockwaves is administered through by applying the treatment head directly into the wound bed. You have the options to set the parameters on the screen of with the control buttons here, and the parameters include an energy level from 1 to 6, a shockwave count that is actually relative to the size of the wound. So the wound area is measured, and we have a chart where you where there has been a formula, and for instance, a 1.9 centimeter square wound would require 1,000 shocks. And if you're treating a diabetic, you can turn up a diabetic who probably is neuropathic. You can turn up the energy to 4, E level 4. And that treatment would take you about 6 minutes to perform. And it's fairly easy to perform, and it's easy to learn. It's something that a wound clinician or a medical office assistant or a nurse could learn. It's not difficult. It's pretty intuitive as well. So you would then apply the treatment directly to the wound bed, and maybe a 2 centimeter peri-ulcer area. And you would do that once a week. We then just continue with the standard of care, whatever that is deemed to be by the physician. And I think you will be typically surprised when you are administering the treatment. You can actually sometimes see perfusion occur in the wound bed. So that is an immediate result of the treatment. And then once the treatment is stopped, as the days go on, you will see other evidences of perfusion. When the patient comes back, by the third or fourth treatment, you will typically see a wound area reduction. So I'm wanting to say that it is a quick or a fast evidence that you will witness. I have a few posters to show you that this poster was done to demonstrate perfusion. As you see, it was done at Kent State University, and the device to measure the perfusion was a near infrared device that demonstrates the areas of perfusion very shortly after treatment. This poster was done at Dr. Meyer's clinic, and Dr. Meyer, do you want to speak to it?
Sure. So I think that the important part of all of this is that DermaPace is a device which has a lot of potential. And I think that right now we are in the process of discovering what it can do based on the principles that we know occur when we use it. So the principles of angioneogenesis, so the ability to stimulate new microvascular growth is one thing. The ability to remove tissue fluid or reduction of edema is important. Its stimulation of growth hormone within the wound beds. So you are stimulating its ability to proliferate epithelial cells that land on the wound bed. It reduces the amount of proteolytic enzymes, their activity in the wound bed, and helps then disrupt biofilm formation or slough formation. So those are the features that we know exist. Those are the principles. So when we embarked on this study here, we were looking for exactly those things. So it's difficult to kind of see here, but we have a variety of surgical sites. I think they involve a 4-foot amputation. The top one is a 5th ray amputation, taking off the 5th digit and half of the metatarsal shaft. The second one is a 4-foot amputation, and the last one is another complicated 5th ray amputation. All of these surgical sites had wounds that were very devitalized and required obviously a fairly major operation to correct them. But the principles that we were looking for was a quick reduction in edema, because as we know, swelling at the wound site impairs healing. And certainly at incision sites that have been sutured, the edema stresses the incision line. And as the faster you can decrease the stress, the tension on the line, the faster the annealing process will begin. So this can happen very quickly when one uses DermaPace. The other complication that we run into with these patients is that all of them had amputations because of distal microvascular ischemia. So they all had gangrenous digits, whether partially or completely. And for that, we wanted a resolution of that microvascular ischemia. So the DermaPace allowed us to, if you will, open up these small blood vessels that feed the skin at the base of these digits, which is the skin that we were using to heal the wounds. So we are utilizing the principles of this shockwave therapy to speed healing through edema reduction, growth hormone production, which stimulates stimulates a faster annealing of the skin margins together. And overall, they healed very quickly to complete closure with excellent scar line quality. So this is the other part of it, is that the speed at which it heals also is reflected in the quality of the tissue that remains. Now, these particular pictures are showing incision lines. We have another series where we've done some, not that one, the one with the 2 digits removed and the, well, these will do. This is the one that I was talking about. So here you have a large wound in which all 4 digits, 1 through 4, were removed, a very large defect in the dorsum of the foot. And we applied dermaPACE over a 3-month period, and we're able to provide a good closure with very supple skin. And this is at the end of treatment right now. And that tissue normally would be very hard and not resilient tissue. And with dermaPACE, we were able to close it with supple tissue. And Susan, if you can go backwards a few, we'll see some on the plantar aspect, like this one in particular. Here, let's talk about this one. This is a very challenging wounds at a midfoot deformity from a Charcot patient. These are wounds that almost invariably result in chronic callus formation, particularly so after a wound has been healed. But in this case, if you skip forward one, I think is the next, no, backwards one. Yeah. So you get a better idea on this particular patient, different patient, same kind of problem. But when healed, that tissue is soft and supple. And the suppleness of the healed ulcer base affords it protection, because that supple tissue is resilient. It doesn't split. The tissue that is scarred and thickened tends to become more dry and split suddenly, or is more subject to trauma and breakdown as opposed to this supple tissue. And the supple tissue, by definition, will have more microvascular perfusion than thick calloused tissue. So that's another advantage, and one a way in which we use dermaPACE in anticipation of what might come. So we are looking forward to healing a wound, but then having a wound bed or a healed wound site that is healthy and remains so that the aftercare is, the burden is lessened for us or for the podiatrist that might be doing the care.
So at this point, I think it might be a good idea to open the floor to questions. If anybody has any questions, I'm going to stop sharing the screen.
Pon el video y pon a Carlos, por favor. Thank you, Susan Baines, Dr. Perry. Thank you. One question. What is the difference between dermaspace and other debates, the shockwave?
Y otro equipo.
The difference between dermaPACE and I'm sorry, I'm not understanding
No estoy
other
entendiendo la pregunta.
Bueno, ok. Por lo menos aquí en México, tenemos la fortuna de
Here in
tener
Mexico, we have the
tanto
fortune.
Dermaspace, que afortunadamente por
We know
parte
we have
de
Dermaspace.
MedSten nos lo ha traído. Sin embargo,
Thanks to
también
MedSten.
contamos con otras marcas.
But we
¿Realmente
have also
existe
other brands.
algún tipo de diferencia entre Dermaspace o en general de los otros equipos que también dan ondas de choque? ¿Qué nos podría, en experiencia, si es que han utilizado algún otro, tanto el doctor Perry como en este caso Susan, nos podrían decir si han tenido la oportunidad de utilizar algún otro equipo?
Have you ever tried another device?
Well, so it depends on what you're talking
Bueno,
about.
depende
Because,
de qué esté hablando.
The Shockwave Dermapace is a unique device.
Dermapace es un equipo único.
Device is really quite like it. And Susan, maybe you can
Sure.
correct me if I'm wrong. There are misconceptions about
Hay
what a
algunos
device really is.
confusiones al respecto de qué es lo que puede hacer este equipo y cuál no.
Devices that use
Hay equipos que utilizan migración o microdebridación.
Those are different.
Esos son diferentes.
Better if you gave an example of what device
Pero
are
si
you referring
nos
to.
da un ejemplo de qué otro dispositivo o equipo es el que está usted usando o ha
tenemos
usado.
otra marca en México.
There is another brand in Mexico.
Digo, en experiencia propia hemos utilizado
kind
los
of technology.
dos.
We have used both.
Cambia un poco
It changed a
la
little bit.
intensidad de onda,
The intensity
pero en
of the
general
wave, but in
también
general,
es el mismo concepto en
it's the
base
same
de ondas,
concept.
y lo mismo que nos estaban comentando.
And it is the same that you have just told us.
Okay, so I'm hearing the interpreter, so I'm not hearing the question exactly.
So allow me to rephrase that question,
Yes,
madam.
please.
Dr. Vladimir Alba is saying that they have a similar technology that is practically doing the same with the same kind of technology and same kind of shocks, wave shocks. And so which will be the main differences between Dermapace and the current devices that they know currently?
Can you tell me the name of that product, please?
¿Nos puede decir el nombre del producto, doctor?
Por fines de protocolo y por MedSten, digamos que no.
Because of the non-disclosure agreement,
I'm going to guess at it, and there is a technology out of China.
Existe otra tecnología china.
That is actually a laser technology.
This technology I'm talking about is from America, from US.
Okay, well, what I can tell you,
without
knowing what I'm addressing, what I can tell you is that Dermapace is the only shockwave technology that has been FDA cleared for wound care.
Aprobada por la FDA para el cuidado de heridas.
Okay. There are other shockwave technologies on the market
that
don't penetrate and don't stimulate the biological responses that Dermapace does. So essentially, Dermapace takes the wound from the chronic phase back to the acute phase by regulating and modulating the inflammatory response. And by that I mean it upregulates the positive growth factors and downregulates the negative growth factors. And so it rebalances the wound to bring it to the point where it can begin to heal again on its own.
Para que pueda volver a sanar.
Shockwave technology that's
La
generated
tecnología
by
de ondas de choque
electrohydraulic energy
está generada
is a
por
very high
energía
acoustic pressure.
electrolítica.
I
Es
hope
por
that helps you
presión
because I am not sure
electroacústica.
which technology I'm
Espero que esto
addressing.
ayude porque no sé contra qué tecnología nos están comparando. Está usted en mute, doctor Alba.
Perdón. Hay varias preguntas en el panel. La
There
primera
are some questions on the
de
panel.
Karen Gala.
Yes, please.
Las heridas, ¿hasta qué profundidad podemos tratar?
So the question is, which is the deepest wound we can treat with this device?
Okay, so we can treat all
Podemos
depths
tratar
of wound.
todos los
We
tipos de
treat
profundidades de
them
heridas.
differently if
Las
there is
tratamos de forma
exposed bone.
diferente si hay
In that
hueso expuesto.
circumstance,
En
we
esa
like to build the
circunstancia,
supporting tissue by
tenemos que
treating the
ayudar al tejido de
peri-ulcer
soporte
area
tratando
until we see supporting tissue in
el
the
área
wound bed,
circundante
and then we can treat directly in the wound bed.
y después tratar el lecho de la herida.
So let me just add to that.
Yes,
So
please.
Quisiera abonar en ese sentido.
the other kinds of, so you can
El
use
otro
this on
tipo
any
bueno,
kind of
pueden
wound,
utilizar
but you
este
wouldn't
equipo en cualquier clase
necessarily use
de
it
herida,
on
pero
super deep wounds. That's not the time to use it really. But what you
para
can do
usarlo en heridas súper
is you
profundas
can
no
use
es
it on
lo mejor.
osteomyelitis.
Cuando estamos hablando de osteomielitis,
So with a wound that has exposed bone,
cuando hay heridas donde hay hueso expuesto,
the studies from my colleagues in the States and
los estudios de mis colegas
we've done demonstrates that
demuestran
aggressive dermaPACE treatments of
que
bones
tratamientos
infected
agresivos con dermaPACE cuando hay infección
has an effect of either killing bacteria or causing the environment to be unhospitable to the bacteria, and speeds, obviously with antibiotic therapy, but speeds the healing of these patients with often chronic bone infection.
Cuando hay infección en el hueso.
And in our center, at least, we would resect or surgically remove infected bone.
Esto se removería de forma quirúrgica.
In combination now with dermaPACE, speeds the healing of that area and the residual infection of the bone tremendously. So that's another sort of different kind of application for bone as opposed to just soft tissue work with the device.
Entonces, lo primero sería tratar la infección, llegado el caso que lo hubiera en hueso, para después tratar el tejido suave con el dermaPACE y que funcionara adecuadamente de acuerdo a la tecnología y para lo que está diseñado. So they are asking me to let you all know that if possible, in order to continue with the presentation, if we could turn off our cameras.
Okay.
Ok, otra pregunta.
There is another question.
En cuanto a tiempo de cicatrización, ¿ha sido solamente con dermaPACE o complementa con algún otro tipo de terapia?
Regarding the scarring timing, do you use only dermaPACE or are you complementing this therapy with another kind of device or product?
So no. So we would always complement the treatment with excellent wound care. So there is
Lo hacemos con un cuidado de heridas. Es una necesidad proporcionar
wound care first,
el cuidado de la herida
and
primero
use dermaPACE as a complementary
y
treatment.
utilizar el dermaPACE como un tratamiento complementario.
And with the two together, you have a faster resolution, so to speak, of your problem. It isn't about.
Y con los dos es como tenemos un mejor resultado.
It isn't about using a device to heal. but more so a device to complement the basic work of wound care, which is in diabetes is offloading, surgical debridement, and application of some kind of advanced wound treatment modality. And those principles, if upheld and then combined with an adjunct treatment like dermaPACE, speeds the healing process. So it really is amplifying your efforts in exemplary wound care first. So that is always our premise, is to provide that kind of care at the outset and then add in a complementary treatment like dermaPACE to speed the closure.
Okay, I'll try to summarize all that, Doctor. El doctor nos explica que el equipo es una cuestión que es un complemento para un tratado avanzado de heridas que obviamente nos va a coadyuvar con una terapia de heridas básica principal que se llevó a cabo previo y que para finalizar la terapia y el cierre adecuado y la integración de los tejidos es que se utiliza el dermaPACE en los diferentes tipos de heridas a los que nos enfrentemos.
So I would like to add to that.
Quisiera agregar a eso.
We like to begin dermaPACE treatments with a clean wound bed, and in order to debride the wound bed, sometimes we might use our other product, Ultra Mist, which is a low frequency ultrasound, non-contact.
Susan, hold on and let me go step by step. Okay, so lo importante que nos comenta Susan es que hay equipos también de ultrasonido que nos pueden ayudar a limpiar la herida. Como principio básico para tratamiento de cualquier herida, lo más importante es la debridación y la limpieza de esta previo a cualquier tratamiento. Yes, Susan.
And then once we clean up the wound, apply the dermaPACE treatment, we move on, as Dr. Meyer said, with standard of care. So we can continue dressing, closing up the wound with the proper dressing until the next treatment.
Ok, entonces una vez que hemos dejado limpia la herida, podemos utilizar el dermaPACE para el tratamiento del que estamos hablando actualmente y continuar con el cuidado habitual que requiere una herida, principalmente hablando de limpieza y los cambios de apósitos que conlleva el tratamiento integral de heridas.
Ok, otra pregunta tanto para el doctor como para Susan.
Another question.
Con respecto al porcentaje de los pacientes que han tratado, ¿qué previamente es el porcentaje de aquellos que necesitan una revascularización previa? Porque ya nos había comentado un poquito el doctor Perry de que pues obviamente la microcirculatura a nivel del pie pues obviamente está en todos los aspectos afectado, pero de ellos, de todos los que han tratado con este tipo de ondas de choque, realmente cuánto es el porcentaje que previamente ya le tuvieron que realizar una derivación o una revascularización.
So according to your experience and the cases that you have done, which is the percentage that once that you have performed the use of dermaPACE, you need to give to the patient a revascularization therapy in addition to the process with the dermaPACE?
I can tell you that we have a high need for that, and probably at least 50 to 60% of our patients will have revascularization at least along the way, if not before we start working on them. But the other thing that is important to note is that it is not necessary if you're doing, and this is where your wound care knowledge has to come into play and your feeling about the wound bed itself. A purely ischemic wound that is badly perfused, so poor blood flow, you by rights should not be surgically debriding this wound. So you should not take a knife to that if there isn't enough blood flow to support it. But with dermaPACE, you can apply. And I don't know what it's like in Mexico, but here in Canada, getting that revascularization is a bit tricky.
Ok, lo que el doctor nos comparte es que en promedio entre un 50 y un 60% de los pacientes requieren una revascularización. Sin embargo, pues todo depende del paciente mismo, así como del tratamiento que se le vaya a dar. Él desconoce a ciencia cierta cuál es el estándar de tratamiento que se le da aquí en México a los pacientes en comparación al que se le da en Canadá. Pero sí, es entre un 50 y un 60% de pacientes que requieren de esta revascularización.
Ok, varias preguntas, voy a tratar de englobarlos en una sola. ¿Cuáles son los limitantes en cuanto a la parte de el uso de este dispositivo? ¿A las cuántas sesiones ya puede notar un cambio? Obviamente sabemos que de paciente a paciente es distinto. Y si lo ha utilizado incluyendo, obviamente me supongo que en cada cambio con el uso de equipos de presión negativa.
Okay, so the question is a combined one. Basically, the main question is which are the real limitations that this device would have and that we have to consider before we use it. How many sessions would a patient need in order to be completely healed with this device, and obviously if the VAC therapy is recommended in combination with dermaPACE?
So I can answer some.
Okay, go ahead.
So I can answer some of that. No single device is going to heal a wound. So that's the first thing that needs to be understood, that this isn't a device that miraculously heals wounds. So it is, and so when used in conjunction with something, let's say like a negative pressure, the VAC therapy is an excellent choice in that the VAC therapy, the negative pressure therapy, is doing something to the tissue, to which when the VAC dressing is taken off in between changes, the wound is then addressed with debridement firstly, but then the effect of the negative pressure is augmented by the treatment of the dermaPACE. So the shockwave therapy enhances the enhanced granulation process or proliferation that occurs with negative pressure. Okay. So it's a very good device to use in conjunction with other treatment modalities.
Yeah, well, one second, please, Dr. Meyer. Para la primera respuesta nos comenta el doctor Perry Meyer que pues definitivamente no existe un equipo que pueda hacer milagros como tal. Sin embargo, él está perfectamente consciente de que la combinación del dermaPACE con la terapia de presión negativa es una excelente opción, sobre todo cuando estamos hablando de estar haciendo revisiones entre los cambios de los apósitos que utilizan el sistema VAC. Por ejemplo, ahora la intención de utilizar el sistema de dermaPACE es considerar que esto en general o en su totalidad lo que mejora es el proceso de mejorar la granulación a nivel herida.
And I'd like to add something to that. If you are using dermaPACE in conjunction with any other adjunctive therapy like that, it will serve to reduce the time or the amount of treatments, because it rapidly reduces the healing time in the first place. So typically, if you have a vac that you are, or a negative pressure, I'm sorry, that you would be using for 30 days, you would probably reduce the amount of time you would need, because dermaPACE quickly stimulates the biological responses that are required to provide an optimal healing environment.
Okay, allow me, Susan. I'm taking notes so I don't forget anything. So, lo que nos comenta Susan es que en el caso en el que ustedes llegaran a utilizar otro tipo de dispositivo, coincide con el doctor, hay equipos que se combinan muy bien como parte de la terapia, y lo que es un hecho es que cuando estamos utilizando el equipo de presión negativa, regularmente podemos contar con que el equipo de presión negativa va a tardar unos 30 días en coadyuvar en el cierre de esta herida. En el momento en que combinamos el equipo de presión negativa, el VAC o alguna otra marca, el tiempo se va a reducir considerablemente, porque esto nos va a permitir que con el sistema dermaPACE se acelere la respuesta biológica para lograr la integración de los tejidos.
I also heard in the question what was the healing time, or how many treatments it would take to heal. And first of all, when the wound is deemed a healable wound, you probably will see significant changes and healing within the first 3 to 4 treatments. Our study shows that there is a significant wound area reduction, 50% wound area reduction in 38% of the subjects in 6 to 8 weeks. So it's very difficult to predict how long it'll take. But from what we see in our studies, it is a lot, or it is much faster than typical standard of care.
Ya nos comenta Susan que como complemento a la respuesta, hablando del tiempo de curación, los estudios que ellos tienen demuestran que entre un 30 y un 50% de los pacientes mejoraron considerablemente el proceso de curación de la herida entre las primeras 6 a 8 semanas. Doctor, está en mute. Doctor Alba, está en mute.
Se traba aquí, pero bueno, ahora sí me escuchas.
Sí.
Perdón, Carlos. Para el doctor Perry, para Susan, en su consideración, ¿cuál es el paciente ideal para utilizar el dispositivo y cuál sería el candidato a no utilizarlo?
Okay, so the question, this is a good one. I like the question.
Okay.
So Dr. Meyer and Susan,
Yes.
Dr. Alba is asking which or who would be the ideal patient to be treated with dermaPACE, and which would not be the ideal patient to be treated with this device, with dermaPACE.
Well, of course, we would treat a healable wound. We want good outcomes. Contraindications for using dermaPACE are very few. Typical, somebody with a malignancy would be one. Somebody who has a let's say a prosthesis would be something else, but with the guidance of a physician, the procedure, the technology is fairly non-invasive, and in our study analysis, it was noted that there were no statistical adverse effects.
So when you say malignity, you mean like tumors?
Cancer, tumor, yes.
Cancer, okay. So en cuanto a las contraindicaciones de los pacientes que no serían ideales para este equipo, pues definitivamente es en el caso en el que encontráramos algún tipo de procesos malignos, cancerosos, pero del otro lado, lo ideal es poder tratar a cualquier paciente que tenga heridas, dado que la estadística nos indica que al ser una terapia que no es invasiva, puede ser útil para prácticamente cualquier paciente.
So I'd like to qualify the answer as well by saying if you have a significantly large wound, that is one area where you would probably apply a negative pressure and reduce the size of the wound as much as possible, and then apply the dermaPACE.
En el caso de que nos enfrentemos a una herida francamente grande, la recomendación e indicación por parte del fabricante es, en primera instancia, utilizar la terapia de presión negativa y como segundo paso, proceder con el uso del dermaPACE.
No sé si alguien más tenga alguna otra pregunta. Digo, es importante recalcar que, como bien lo han dicho durante todo este tiempo, esto es parte de la terapéutica como el tratamiento en una herida en un pie diabético. Esto no va a compensar, como bien lo dicen, de que si en dado caso el paciente necesita una revascularización, si en el caso de que durante el tratamiento se puede hacer coadyuvante algunos otros equipos que nos puedan ayudar, como lo es el uso de la presión negativa, independientemente del tratamiento avanzado de las heridas, pues obviamente esto es un buen ejemplo de terapéutica que podemos utilizar. Es una de las herramientas tecnológicas que afortunadamente contamos con la oportunidad de tenerla aquí en nuestro país, que obviamente también era parte de la expectativa que teníamos, el poder dar a conocerla, obviamente pues con la presencia de Susan y la presencia del doctor Perry, para que nos dieran su experiencia, sobre todo los pacientes diabéticos, que obviamente en este caso pues el doctor Perry es una eminencia que está totalmente dedicado a eso, y pues obviamente Susan que nos ha hecho pues también partícipe de toda su experiencia.
So as a summary, if you allow me, Dr. Alba, just to let you know, Dr. Alba mentions that it's a very, very important for us as Mexican health professionals count with this kind of technologies as a technology in addition to the other technology that we have. So thank you very much for presenting this technology that we know that is available in our country, and for all these examples and cases that you have just shared with us.
I'd like to thank you as well, Dr. Albi, for the opportunity, and please don't ever hesitate to contact us if you have any further questions, comments.
Le agradezco muchísimo al doctor y a la asociación. Si llegaran a tener alguna pregunta adicional o comentario, no duden, por favor, en ponerse en contacto con nosotros de inmediato.
La última pregunta, Carlos, un favorzote. Me ponen aquí, ¿cuál sería la medida máxima de una herida para poder tratarla con el dispositivo?
Okay, this is the last question we have from the panel. And this is, which would be the largest wound size that you recommend to be treated with the dermaPACE?
So our wound protocol can go up to 17 square centimeters.
Okay, la respuesta estándar es que ellos recomiendan que sea como tamaño mayor de 17 centímetros cuadrados.
Pues si no hay ninguna otra pregunta, pues agradecemos tanto a Susan Baines como al doctor Perry Meyer. Thank you.
Thank you.
Thank you. It's an honor. Thank you.
And thank you, Carlos.
You're pretty welcome.
Por último, quisiera nada más dar algunos anuncios parroquiales con respecto a la sociedad. En este caso, nada más dar el anuncio del diplomado en manejo multidisciplinario del pie diabético en la actualidad de Mexipied 2021. Va a iniciar el 26 de junio del presente. Todo lo que es costos, cómo va a ser el módulo, todo lo pueden ver en la página. Si no, cualquier duda o pregunta pueden contactarse al correo de karen@amexipied.com. Otro anuncio sería que el próximo 21 de junio a las 6 p.m. va a ser la otra plática dada por la doctora Lía del Carmen Reilly, que ella es de Panamá, es una experta en el uso de apósitos y obviamente el tratamiento avanzado en el cuidado de heridas. Y por último, nada más para hacer de su conocimiento, este año cumplimos 20 años y como parte de la celebración queremos hacer este congreso de modalidad híbrida, tanto presencial como de parte virtual. Va a ser el próximo 25 a 27 de noviembre. Por favor, todos los interesados para que se empiecen a comunicar y que veamos todas las opciones si es que pueden acudir con nosotros. Pues muchísimas gracias a todos, muy buena noche. Espero que haya sido de gran interés el hecho de este nuevo dispositivo. Aquí bien importante, insisto, esto es solamente una herramienta, no es la panacea, no es como decía el doctor, lo más mágico, pero afortunadamente sí sirve y vaya que sí sirve bastante bien. A todos, muchísimas gracias por el tiempo de estarnos viendo. Ojalá nos puedan el día próximo con la doctora Lía también estar al pendiente de la presentación. Y pues de antemano, Carlos, muchísimas gracias. No hubiéramos podido lograr mucho sin ti.
A la orden, doctor.
Muchísimas gracias a nuestros expertos. Muy
Gracias,
buenas
doctor.
noches.
Gracias a Mexipied. Thank you, Dr. Perry, and thank you, Susan. Have a good one.
Thank you.
Buenas noches.
Buenas noches.
Good
Bye.
night. Thank you.
Well,
Bye-bye.
bye.
Thank you.